All right, great. So thanks everyone for being able to join. We have Bernard with us, who's going to describe the franchise benefit solutions, which is a great opportunity for potentially the stores to offer benefits to employees. And thank you, David, for bringing Bernard to us.
Absolutely.
Just to let you, franchisees, board members, know that Dave and I met at the IFA conference. What about 3-4 weeks ago?
3 or 4 weeks ago, that's right.
Again, my name is Bernard Rubenstein, Managing Director of Franchise Benefit Solutions. I want to welcome you to our Franchise Benefits Program webinar. Over the next several minutes, my goal is to provide you with facts about franchise benefit solutions, some of the challenges that we find are facing franchisees today. We'll review our products and services, review how we plan on working with your franchisees. What do we find as the most popular benefit packages to help your franchisees hire and retain employees? How we can help you educate prospective franchisees on offering a viable benefits program, answer a few questions you may have thought of while looking at the presentation, and finally moving forward. With over 40 years of experience specializing in customized benefit programs to the franchise community, our firm provides exclusive plan designs to franchisees across the United States. Over the years, we've had the privilege of partnering with Authority Brands, Best Life Brands, Five Star Franchising, Velpac, Grocery Outlet, The Joint, Chiropractic, Miracle Ear, and Ace Handyman, amongst others. In recent years, the insurance industry has witnessed many changes. Our clients are aware of the changes going on, and many have expressed an interest in offering alternative benefit plans to help recruit and retain employees. There are many challenges facing franchisees today. Here are a few challenges we hear facing franchisees that relate to benefits. First is the lack of benefits to attract new employees. In today's competitive job market, offering attractive benefits can be a key factor in attracting and retaining talent. Second is offering affordability of healthcare. Healthcare costs have been rising steadily, and franchisees may find it increasingly challenging to afford healthcare coverage for their employees, impacting both recruitment and retention efforts. Third would be limited back office knowledge. Many franchisees enter the business world from non-business backgrounds or from corporate sector, where they may not have gained experience in areas like benefits administration. And finally, healthcare mandates. For franchisees with over 50 full-time employees, the Affordable Care Act mandates that they offer healthcare coverage to their employees or face penalties. We've been working with franchisees for many years. We have a solid understanding of the franchise industry, which allow us to focus on building a benefit strategy and developing long-term relationship. Our plans and rates are exclusive to your franchisees. Our plans and rates are the same no matter where your franchisee is located. If you have a franchise in Florida, Michigan, Washington, or California, our plans and rates are the same. We don't require employer participation or contribution. Our plans can be employer paid, standalone, volunteer, or packaged together through payroll deduction. We've optimized our enrollment process, which means less work for the franchisee. We provide you with a branded page. Now this would be on a franchisor. We provide you with a branded page that would be linked to your corporate site, outlining our products and services available. And we would provide you with training and support for your prospective franchisees. Over the years, we've partnered with many franchise systems and are our list continues to grow. We just added, at the bottom right, we just added Miracle here. Matter of fact, I just presented our program to their franchise network about an hour ago. And we also, within the last month, added Ace Handyman Service, which is a brand of Ace Hardware. Our program portfolio includes medical, dental, vision, life insurance, accident, critical illness, hospital indemnity, telemedicine, prescription drugs, and short-term disability. Like I said, our plans can be employer paid, standalone, voluntary, or packaged together through convenient payroll deduction. Our benefits program includes 3 medical options: individual, family, comprehensive, group, and voluntary group. For those franchisees that don't want to offer a group plan for their employees, or are looking for an individual health plan for themselves or their family, we offer an online quoting portal they can view at their own convenience. As you can see, on the screen there, once you put your information into the individual quoting portal, you'll find out plans that are available from the lowest cost to the highest cost. This is only, one here in Michigan, and it shows from the lowest cost, and it's only 3 plans up here, but it'll end up showing you, could show you 20 plans, 25 plans, and it'll be, again, from the lowest to the highest cost. You can find out if you qualify for financial help or a subsidy. You can view the benefits, as you can see on the screen, view local providers, apply online, or download an enrollment form. If a franchisee is considering their group plan options, we can help them make the right decision that best meets their needs as well as their employees' needs. Group plans are based on the demographics of their company, along with their employee and dependents' ages. We would need a census information in order to provide them with a group plan proposal. Our group plan, a minimum of 2 employees are required. We generally use United Healthcare on a national basis. And the reason we do that is because we have our own team, sales rep, claims rep, admin. So anytime we need we have a question, we need an answer, we go to our team. Otherwise, with other carriers, even with the Blues are set up on a state-by-state basis, where if we go to that Blue Cross of that state, we may not, we'll ask a question, but may not get an answer for a day or 2. Whereas us working with United Healthcare on a national basis, we go directly to corporate. And again, we have our own team set up. Our third and most popular option is our low-cost voluntary group medical plan, which is similar to a association health plan. Our plans are the perfect strategy for franchisees focused on cost containment, usable daily benefits, and compliance with ACA mandates. Our WellCare plan, which you can see on the screen, the names, includes preventative services only, while the Prime Care plan includes preventative services and limited primary care visits. Our most popular Elite Care plan covers preventative services, primary care, and specialist visits, along with urgent care, lab and x-ray services, and generic prescriptions. Our IHP plans provides more comprehensive coverage, such as in and out patient, hospital, inpatient, outpatient, emergency room, home health care, behavioral health, and prescription drugs. Get a little more into our plans. The voluntary plans, we go down to 1 employee. That's all we need, is just 1 employee. So if a franchisee comes to us and says, hey, I've got 10 employees, but I know there's only 1 employee who wants to enroll, we'll take that one employee. So we offer 4 voluntary medical with minimum of 1 employee. The first is WellCare, which simply just covers physicals only. Our second plan is our Prime Care. It also covers preventative services, but it also includes primary care visit. It allows up to 3 visits at a $15 copay. Behavior health is also included, since COVID, there's been a lot of questions when it comes to behavior health. So this year's the first year that we included it. And it also covers prescription drugs. Our Elite Care is a little, again, is a better plan than the Prime Care and WellCare. This plan has a $15 primary care and specialist care, and there's no limit on the number of visits. Also includes urgent care, lab, and x-ray, again, behavior health and prescription drugs. And our Advantage plan is the same as the Elite Care. However, it also includes a value-added benefit similar to an Aflac plan, but this year we decided to go with MetLife. Includes a hospital admission. It'll pay the member up to $1,500, 4 visits per year. Hospital confinement, $300 a day, up to a max of 15 days. Now, again, you may think, wow, it doesn't really cover much. If you're looking for catastrophic, then these plans here are not a plan that you'd want to look at. However, when it comes to the advantage of this is it goes down to 1 enrollment, and the cost of this, a WellCare plan may be somewhere around $55 to $60 a month. And we find that employers may use the $55, $60 contribution and tell the employees, well, we're going to provide you with physicals and cover our physicals 100%. And then if an employee wants to upgrade, they can do that. Again, there is no employer participation required as well as contribution. These plans here are the same plans, same rates, doesn't matter what state that you may be in. Our IHP plan options, the core and the prime, are more comprehensive type programs where they do have inpatient, outpatient services as well as pharmaceutical benefits. You'll notice that the hospital and facility benefits here have asterisks at the end. What that means is after the copay, benefits are subject to reference-based pricing, which means reference-based pricing is Medicare. So as long as that hospital or facility accepts Medicare, then they will accept our plan. We've had this for 2 years now, and we have not had one issue with these plans. So again, these plans, there's no medical questions, no pre-existing, no waiting periods. It includes inpatient and outpatient services. And additional services include emergency care, maternity, prescription drugs. Now, on this program here, we do need a minimum participation of 5 enrolled. So, and they have to maintain 5 during the year. So again, if you're looking for a comprehensive, then there's 2 choices. One would be the IHP, this plan, or our plans through, let's say, United Healthcare, where we only need 2 full-time employees. Dental plan, I do want to go back here 1 second on this IHP. The reason I bring the IHP where you need a minimum of 5, whereas the United Healthcare, for instance, we need 2. The reason is because the 2 differences, the IHP, the cost actually may be half than what a comprehensive plan. For instance, a United Healthcare plan, a single rate may be anywhere from $500 to $800 or $900 depending on the age. So if you're going to have somebody older, let's say in the upper 50s or 60s, comprehensive through United may be $800, $900 a month, whereas the IHP plan here is anywhere from $400, $500. So there is a big difference, and there is, it's also dependent on the numbers that must meet the participation requirement. We also offer dental. We offer 4 plans, 3 through MetLife and 1 HMO plan for California franchisees through Delta Dental. It's a Delta Care plan. The MetLife 3 plans, plan 3 and 4 are the same. Benefit max is up to 1,000, and this is normal in the dental line of benefits. The plan covers 100% for preventative, 80% for basic, 50% for major. Plan 3 does not include ortho, where Plan 4 does include ortho. Plan 5 is the exact same as Plan 4, except Plan 5 benefit is up to 2,000 rather than 1,000. Cost for, let's say, Plan 3 is around, I think, $42 a month. Plan 5 is around $50, $52 a month. The HMO through Delta Care, I think, is $26 a month. The advantage of the HMO is you just pay simple copays. Office visit is $5. There is no maximum when it comes to the HMO plan. Vision is through VSP, administered through MetLife. The difference, we offer 2 plans, plan 1224 and 1212. The difference between the 2 plans is the 1224 glasses is covered every 2 years, where 1212 is covered every 12 months. Eye exam, $10 copay for both plans. Copay for glasses is $25 copay, the same. When it comes to the max frame allowance for the 1212 is 130. I'm sorry, 1224 is 130 and 1212 is 150. The VSP plans also include retail chain providers such as Costco, VisionWorks, and Sam's Club. I think the average cost for the 1224 is around $7 a month, whereas the 1212 is around $9 a month. Life insurance, we offer 2 plans. One is employer pay, where the plan is offered to each employee, $10,000 benefit. And again, this is employer pay, and the average cost, and don't quote me, is around $235, I think, $240 a month. Voluntary life is 100% employee pay. The employee can select up to 150,000 or 5 times their annual salary. They can purchase 50,000 on the spouse or 50% of the employee amount. Dependent children, a maximum of 10,000, which includes all the dependents. Evidence of insurability is not required when first eligible. So if an employee in the 2nd or 3rd year says, hey, you know what, I decided I want some life insurance, they are going to have to qualify with healthcare questions. This year, we added a new virtual primary care. Virtual care, primary care is the same as the going to a your own doctor's office. Let's say you're going in there for a physical. This is the same as going into the doctor's office, except this is virtual. So you may ask, well, if it's virtual, how is it the same? Well, you select your own dedicated physician. You have your own primary care doctor. When you're ready for your annual exam, again, it's virtual. You talk to your doctor. They'll go through assessment review. They'll send you a generic testing kit. You'll prick your finger, send the kit back to the lab in a prepaid package, and then your doctor will reach out to you, review your lab work, and if there's any questions or if they need to work out some type of intervention with you, and you work out with your primary care physician. They'll even call in a prescription for you. It also includes psychiatric and behavior health benefit. And there's also, which this year is the first, is prescription benefit. It's a long list of prescriptions with no copay. And the plan also includes a telemedicine, which is different than the virtual primary care, whereas just like a teledoc or telemedicine where you call in, give them your symptoms, and they'll give you a diagnosis and they'll call in a prescription. Now, the telemedicine 24/7 access would not be with your primary care, but it would be just calling in like a telemedicine. We offer a hospital confinement, 2 benefit options. Benefits cover both injuries and sickness. Benefits are paid to the member for inpatient, outpatient medical treatment received in a hospital, emergency room, and physician's office. It'll include hospital benefits, treatment benefits such as emergency room, doctor's office, diagnostic procedure, prescription drugs, and surgical benefits. And again, this is just an overview of some of the benefits. We offer an accident plan, covers accidental injuries regardless of any other insurance. Benefits cover both inpatient and outpatient. Covers more than 50 benefits. Hospital admission, hospital confinement, ambulance, emergency room. Now, in addition to the services, they'll pay you a lump sum payment for any fractures or dislocations. Fractures, let's say you had a skull fracture, it'll pay up to $5,000. Forearm, let's say you break your arm, you'll pay up to $1,000 lump sum. Dislocation, let's say you dislocate your collarbone, it'll pay up to $1,500, or you dislocate your knee, which my son did, it'll pay up to $2,500. Other services that we offer is a consolidated billing, online HR services, Section 125 premium only, which allows you to deduct contributions from your employees. And also we offer COBRA administration. Our benefits enrollment platform includes 4 steps from the initial contact through the employee enrollment process: identifying the employer's objectives, reviewing the benefit options, providing easy to understand benefits communication, and optimizing the enrollment process through our integrated portal. So basically, we would begin, talking to your franchisees, what their objectives are, if they have any type of budget. If need be, we would gather some of gather census information. Once we obtain quotes, or you can see there's an employer guide here. We actually have our employer guide. We would provide you with benefits and rates. We would send you the benefit options, review them with you, formulate some type of benefits plan. If you decide you're going to go with us, then we would provide you with a easy to understand communication, employee guide, or a fax overview. If need be, conduct a benefits webinar. And then in the meantime, we would build out our online enrollment platform, which would tie the employee communication to our enrollment system. Employees would enter their demographic information and go through and select the plans that they're going to go with, or with their families. It would be one application, one bill, one online enrollment and administration system. So, from the beginning, working with your franchisees through the enrollment process. So we have a 4-step objective of working with them. A few slides ago, I mentioned the steps on working with sorry about that. Working with franchisees from the initial contact through the enrollment process. Many franchisees ask us to help them set up a program which would help them hire and retain employees. Our most popular solutions, as you can see, we have 4 packages up here. Our first one is where the employer offers our voluntary benefits to all employees at 100% employee pay. So you as the franchisee do not have to contribute. There's no contribution requirements. You just decide which plans you want to offer from our employer guide. And then we set up the rest for you. So you don't have to contribute. Your employees will not even know if you contribute or not, because once they enroll or go into our enrollment portal, they will only see what they are responsible for. And I'll even show on the system what, based on your payroll of either, biweekly or semi-monthly, they'll only see what their cost is, what their deduction amount is. So we don't have, or if we do, minimal amount of franchisees that actually contribute towards, let's say, the dental, vision, life, telemedicine, the voluntary benefits. We rarely have an employer contribute towards that. If there is a contribution, it will be on the medical only. So package 1, the employer simply offers our benefits, 100% employee pay. Package 2, franchisee offers a voluntary medical plan that contributes towards the employee only cost. And again, you simply decide. We have employers that say, hey, I'll contribute $25 or I'll contribute $50. You decide what you contribute. As you can see, as I'm going through this, you really set your own plan up. What plan do you want to offer? The cost of the plans, contribution wise, you decide. You can even set it up by class. And what I mean by class is you can have and that's really rolls into package 3, where you would set up a class based on ownership, management, non-management. If you have your own class of employees, we'll work with you on your own class of employees and how you want to contribute. However, just remember, whatever class you set up, whatever employee is in that class has to be the same for that employee in that class. So whatever you contribute towards one in that class, you have to contribute the same in that class. We have run into where employers have different management employees, but let's say they have their son in management and they want to contribute more towards their son than a different management, then we may have it set up as a different type of management employee, just so the contribution levels are different. So package 2, the employer offers dual voluntary medical and contributes toward the employee only cost. Employee contributes the balance of the employee cost plus dependent cost, and if they decide to buy up, and then again, voluntary benefits, employee pay 100%. Package 3, which I was just talking about, employer enrolls in a management only group health plan. And there is a special enrollment period, which is at the end of the year, the last 2 months. And being that we're really still in the first quarter, we'll get into it as the months go on. So the employer contribution, like I said, ownership 100%, management 50%, and then when it comes to the voluntary benefits and the non-management employees, the non-management employee contributes 100%. Package 4, employer enrolls in a comprehensive group health plan. Let's say what we were mentioning prior with United Healthcare. Employer offers dual medical option and contributes 50% of the employee cost of the lowest plan. Employee contributes the balance of the employee cost plus dependent cost, and if they decide to buy up. And then again, voluntary benefits, employee pay 100%. We often get asked from the franchisor to help educate prospective franchisees on offering benefits to their employees. Many prospective franchisees come from the corporate world and aren't trained on how to run a business. We will help you with educating your prospective franchisees with why they should offer benefits to their employees and help them set up a strategic benefits plan. In today's hiring market, a benefits package is essential for attracting and retaining top talent. Once franchisees have a great employee base, they want to keep them from jumping ship. So we'll help you set up a strategic plan. We'll work with your franchisees on setting up a program, helps them set up a budget, provide them with plenty of options. We do want to, we may not be the broker that they go with, but we want to, make sure that they understand what's available. And hey, if there's a local partner they want to go with, that's totally up to them. So now here are some questions that have come up, and Tina, I think we went over this before, because, working on the franchisor side, we want to make sure that you as the franchisor, that, some of the Q&A that have come up that you may not have thought of, questions such as, what if any liability is there with the franchisor? There is no liability because, number one, you don't want to be involved. Once we are approved as a vendor partner, we work directly with each franchisee. They make their own decision. They have their own EID code or number that our carriers are going to ask for. Is there any cost to the franchisor? No, there is no cost. Does each franchisee set up their own benefits program? Yes, we work directly with each franchisee. Carriers require employers to provide their employer tax ID number, so it's kind of makes it easy. Do franchisees have to contribute? No, as I mentioned, plans can be employer paid, standalone, voluntary packaged together through payroll deduction. How easy is it for a franchisee to set up a program for their employees? Our sales and implementation team provides support and guidance tailored to the unique needs of each franchise to ensure successful implementation. What's the minimum number of employees franchisees need to start a program? One advantage of our program is that most carriers have participation and contribution requirements. We do not have those requirements. Can the program be started anytime during the year? Yes, they could. Does Franchise Benefit Solutions work with recognized carriers? Yes, on a national basis. We work with United Healthcare, Blue Cross, Kaiser Permanente, Delta Dental, VSP, and MetLife. Does Franchise Benefit Solutions provide reports on the number of enrolled franchisees? Yes, upon request. We will provide you with quarterly report of initial contacts, their status, and enrolled franchisees. So again, on the franchisor side, you see what we can do for your franchisees and how we work with you. On the franchisee side, they set up the program as they see fit, a comprehensive program. If just the franchisee wants to look for themselves or their family, we have a quoting portal. We have a voluntary program. The employer has total control on how they want to set up the program. So I guess at this time, if anyone has any questions moving forward, with your advisory board, if any of you want to work with us, that way you get an idea on working with us, how the program works. If you decide to go with it, how easy the setup is, then you can report back to Tina and Dave. And we would set up a webinar with your network. Expected timeline is about 2 to 4 weeks. I'll just give you a idea on how, what it takes to moving forward. Again, here's my contact. Anyone have any questions?
Well, I'd like to make a comment with Franchise Benefit Solutions. What I really like about them is clearly the flexibility, kind of his overview. And what I've noticed over time that is really neat is some of the brands like Authority brands and Best Life brands that launch a lot of different individual brands within their franchising networks. You know, they take care of their franchisees first, and then you can add it to your employees, right, to help retain them, right? So what they've seen in some of those other franchisors is that, my gosh, it's kind of become addictive. They start with one or two or three or four or 10, and then all of a sudden everybody is joining. When a franchisee starts, they can just cover themselves, right, with medical benefits, after leaving corporate America. And then, of course, passing the benefit on to key employees and then eventually to more employees, right? So I've just, at one time in my life, I walked a benefit program into a franchisor at the very beginning when very few franchisors had medical benefit programs. And this is just a program that has very much evolved. It's very flexible. It's affordable. And it just can take care of teams. And so I just wanted the advisory board to be able to look at it. Uh, it's why I brought it to Tina's attention and yours. So those are the only comments I have with that. I'll be quiet and I'll let everybody else ask Bernard questions.
I don't have any questions. Looking at the program, I think I don't see why we wouldn't offer this to our franchise group. I know that some people have the benefits covered and others are going outside of the group. Sounds like you have so many solutions to offer. I don't see what the harm would be in offering this to our group at all. I think it would help, and I think it would certainly help on the sales end for David to have this in our back pocket. So I just, maybe I'm missing something, but I think it's a no-brainer to push it out to the franchisees and let them make their own decisions.
I
I'll
would
ask
agree with,
I'm
I would
sorry.
agree. This is Nancy, I agree with Jeff on that. My only thoughts on it is it's just so complicated. I mean, there's almost too many choices. So does it make sense to narrow it down a little bit for what we offer?
To be honest with you, when it comes to the webinar, yes, I'm trying to show you everything. I could have,
Mhm.
eliminated, which I didn't when Tina and Dave, when we first spoke, I just showed the, overall picture of it. But once you would receive our employer guide, you would see the benefits that are available. And there are, most owners, franchisees, they have in their mind of what type of plan, if they want to contribute, or if they can even afford it. That's what I'm here for. I'm here to help you kind of decide. We have franchisees that only want to offer one plan. They don't have to offer the full gamut of products. If they only want to offer the medical only, we'll do that. We have some franchisees that will offer, the most that we find is 3 medical plans. And then they'll offer the dental, vision, and the other benefits because the employees are selecting it on their own. They decide what they want to select. There may be, we have a few franchises that only one employee enrolled and it was just for dental. So, most carriers they require at least 5 or 10 employees to enroll in a specific product, where we go down in one. It doesn't have to be the medical. They could have dental. We'll still invoice it for dental. You gotta remember, this is a franchise program. It's not, we're not looking at it as just one company. We're looking at your whole franchise system.
Correct me if I'm wrong on that. It sounds like you would present something to our group on a similar webinar as this. And yes, I agree with Nancy. Like going through, I was like, wow, a lot of choices. How would I figure that out? But what I'm hearing you say is you or someone personally connects with each franchisee to talk about budgets and needs and these kind of things, and you help curtail a recommendation towards that.
100% correct.
Okay. Okay.
When I
Yeah,
showed
because I
you
agree.
when I showed
It
you,
looks overwhelming at first, but
no, I
yeah.
agree. When I showed you at the one screen, that showed the 4 different steps.
Yes,
Step
sir.
1 is where we would go over benefits that are available to them. When they reach out to us, they would receive our guide. So they'll already have our guide in hand to show what benefits are available. And then once we actually have the phone call with them, we'll go over it. They may want to go a different route. They may want to go the comprehensive. They may already have a comprehensive plan in place that they want to see an alternative, but they don't offer dental, vision, and or other services or other products where they want to. So then they'll end up switching over. So each franchise is going to be different, and it's going to be based on what they're looking for.
Okay. Thank you.
I see we have one.
Obvious question here. Can we get your deck? Your slide deck? Is that something you're gonna share?
Yeah, I will send it. You know what I'll do is, being that, well, this is being recorded, so I will get it over to Tina and Dave, and then they can
Perfect.
distribute it to the board. And my contact info will also be part of it. It'll have I'll include a QR code with that also, Tina.
All right, thank you.
Does anyone else have any questions?
No, looks like we're good to go.
Okay, so what I'll do is I'll get this over to you most likely tomorrow. And then being that we're already at about 5 o'clock, I'll get it to you tomorrow. And then we can talk next week on moving forward, or if any of the board members would like to, reach out, we can start with that and then go from there. I will leave it up to you, Tina and Dave.
Okay, yeah, let's get together next week. I think probably we should schedule a webinar. I think the advisory council is 100% on board with moving forward. So we should probably just not wait on it, get it out to the people.
Okay, why don't we do this, being I think next Friday is Good Friday? Do we wanna wait till the following week after Easter, being that, or in between Good Friday and Easter, or I'll leave it up to you.
Okay, I'll send you some proposed times and then we'll get it nailed down.
Okay. Anyone else have any questions?
Is the webinar gonna be the same as what we just did?
You know,
Or,
good question, because what I tried to do is to interact the franchisor presentation along with some of the franchisee. So I'm gonna say most of this is yes. Because you're probably thinking, do I need to attend the franchise?
no, I wasn't. I just, I mean, it was a lot of information and some of the screens, at least how I'm viewing them, it was difficult to read, so I'm just kind of thinking on that line, just how what we might consider doing, a little bit different, if it's gonna be shared with all of the stores. I don't know. I mean, could everybody else, I'm on a laptop too, so that it could be, part of that could be the reason why.
Well, you know what, you make a good point because there's a few presentations that I've done when I really don't get it into each benefit. I will just mention that these are the benefits that are offered. And the one screen that I put check marks show, the different plans. We generally, we would show just those screens. So for the ones that are interested in learning more, then they can reach out to us.
Yeah, that's what I'm thinking, is because the next step after everybody, after if people watch the webinar, if they want to get in touch with you, then they're gonna go through all of the
I get it.
details, right?
I get,
Yeah.
but what I wanted to do here, that's the way it was, the presentation I had with Tina and Dave. I didn't have the actual coverage in there. I just had the check boxes because it would be more involved, but I wanted you to understand, to see the actual benefits, because you're the advisory board. If you didn't see it, you're just gonna look at it and go, okay, this way I showed it to you so you could see the actual benefits on what's offered.
Yeah, I think Nancy's suggestion is probably good to, pare it down a little bit, shorten it. And, the idea, like the slide about, all the different things were available. The check mark slide was very good. And one of the last slides where it said, hey, you can do it one of four ways. I thought that was extremely good. And if you want more information, here you go. Our group, we have short attention spans, and we were always in a store, and there's customers coming in, and we're getting interrupted and stuff. So I think the shorter you can make it with getting that information out, the better retention you'll have. So
Yeah,
great suggestion.
I agree with that, because what you really want them to do is to get in contact with you afterwards
I agree.
to learn the details.
Now, you just mentioned the one screen that has the 4 ways of working with your franchisees. I also have another screen, or the one slide that shows the different packages. I also have a slide after that that'll give an example of cost, on splitting the cost and how it's set up. Do you want me to show that one too?
I would think that would be helpful for people. Yes. Understanding costs and how to split it up. And that's going to give them the idea of, hey, do I want to go forward and talk more, or is that just out of my range a little bit? So yeah, I think that would probably be helpful. That's my opinion. So, but someone else may disagree with that, but
No, because you know what? The way you're, both of you are, talking about, I've done that way also because of the attention span of people walking in and out, because I work with grocery stores too, and they're always in and out. People always asking questions.
yes, sir. Okay.
Yeah, that's great.
Okay, so moving forward, I'll work on the presentation. You know what I'll do, Tina and Dave? I'll send it to you if you want to distribute to your advisory board so they can see it before we set up the webinar, or before we can set it up, but then I'll get it over to you. You all can look at it, and then we'll if there's any slides you don't want to put in there, we'll go from there.
All right, that sounds perfect.
Okay, I appreciate it. I'm glad you're all involved, because a lot of times we don't get to this point here of the advisory board coming aboard, asking questions like you have. So I really appreciate that.
All right,
Well, we
great.
Okay,
appreciate.
Mr. Rubenstein, thank you.
Yes,
Okay.
thank you very much.
Okay, take care. Talk to you soon.
Bye-bye.
All right, bye.
Thank you all.